So my father worked at Montefiore Medical Center and often took me to work with him. So I had this great opportunity to see how a hospital functions. What was all involved in patient care. It wasn't just about the doctors or the nurses, it was about lab, it was about the people cleaning, hazard control, hospital administrators, and I knew once I had that exposure that I wanted to be involved in healthcare in some form. I think there are quite a few obstacles. If you think about me being an inner city kid, and my father was the first, wasn't born here, he was the first of his family to come here. My mother was born here, but, coming from a single family home, there were a lot of obstacles in that respect to overcome. I was fortunate enough that they put me in a good school and they both worked, so academics was always emphasized. But once you leave college and you leave that comfort of home and you're out of the city, you really have to learn how to adapt and acculturate. And so there were quite a few obstacles. There are certain things that you can't say that you can say in Hispanic culture, should say in American culture and vice versa. So I had some mentors along the way that would help. And then from a professional standpoint, your obstacles are, you really have to prove yourself. You have to be knowledgeable and you have to be well-read and you have to be innovative. And those are obstacles that you still see today. Sure. As a woman and as a diverse woman, I don't know what was worse. I remember a time when I was working for a pharmaceutical company and I was a rep and there was an opportunity to attend a conference of Hispanic physicians. And I thought, oh, this is going to be great. This is going to be for me. I'm in a good territory. But somebody else got it. And I thought, well, why wasn't I involved? Because I had the better match. And I had to prove myself, and I was able to go on the next round. But I thought that it should have been a discussion at least. And these are obstacles that you have to overcome. I think also men and even some women find it unusual if a woman is bold, if she's outspoken, if she knows her data and can source it well and reference it well. And some women are threatened by that or uncomfortable by that. And some men think a woman is the B word. And so as an obstacle to overcome is to stand your ground, be knowledgeable, and move forward. There are quite a few. You have personal role models, and then there's professional role models that I have. Personal role models, I think about my grandmother all the time. She was a single mom, came here to the States. She had a third grade education, supported her whole family, but yet at the end of the day, she was able to buy a house. So I think that's just an act of perseverance. We have women in society, Sonia Sotomayor, who's now working in the legal system here in our government. We had the first Hispanic Surgeon General, Antonio Novella, who is another role model. And I think we have all sorts of celebrities and women in science. And I think now with social media, they're really taking an active role in empowering women to be themselves and move forward. To not look at your physical beauty, but focus on your inner strength. And I think we see a lot of that today and moving in the right direction. And you really have to give kudos to those companies who are embracing that. I think Legos actually has the new Women in Science Lego set. And I think that's great. It's long overdue. Well, for women who want to pursue the same field, you have to be knowledgeable. You have to know your science. You have to be ahead of the game. We're involved in an industry that is about patient care, and we focus on giving that patient another day or improving their quality of life. And if you want to be in this field, you have to know the science. If you are a woman of a diverse background like myself, I think you have to be even faster and know that field very well, because there's going to be a certain expectation that you're going to fail and you don't have all that information. And as a diverse woman, you want to be ahead of the game.